Hi, Dr. Sarah. Welcome back.
Hey, Dr. Lisa, thanks for having me again.
As promised, we're back so that you can talk to people about how to catch cancer early and how to prevent cancer. So let's jump right in. Can you tell people, how do you catch cancer early?
Okay. The best way to catch cancer early, meaning find it when it's really small, and that means that there's the best chance of getting rid of it and curing it, is to do what we call screening tests or screening exams. You'll hear that all over the place. And that's just one general term to talk about tests that are done by your doctor. Sometimes it's an x-ray of some sort, sometimes it's a physical exam, sometimes it's a blood test to help us see if there's any signs of cancer in you that you're not feeling or you may not know. So that's the best, to be able to catch it before you even know it's there. And so, for example, a screening test for breast cancer, of course, we know, are the mammograms. A woman starting at age 40 should get a mammogram once a year. And if you have a family history of breast cancer, maybe sooner. For men, you should be screened for prostate cancer because it's a common cancer of men that is so curable if it's caught early. It is.
How do you do that screening though?
So and it's changing, it's evolving. There is a blood test called the P as in Paul, S as in Sam, A as in ant, PSA test. It's a blood test. And if it's elevated, it may indicate that there could be a cancer in the prostate. It could be elevated and it's not a cancer too. So it's very important that you know that just because if you do get a PSA test and it's elevated means high, it's higher than normal. Your doctor says, oh, your PSA is high, does not mean cancer. Okay, there could be just what we call benign, a large prostate. It could be a little infection, but you got to check it out. So there's also, we used to do digital rectal exams, meaning, your doctor would put a glove on and he would take his finger and he'd go in the rectum because you can feel the prostate through the rectum.
And I've heard men say, I don't want that to happen to me. You're not putting anything up there. So let's just break it down and talk about why that's really important to get that finger up there.
Right. So it's important because especially the doctors who do it all the time, they know what they're looking for. And in an enlargement, sometimes you can even feel a nodule on the prostate that could tell you that that's cancer. And we know if cancer is not treated, if it's left alone, if that nodule is not found and is sitting there, it's going to grow and eventually grow to other parts of the body.
Is there no other way to find it other than putting the finger up there?
Well, I'm telling you, it's less and less that they're using the finger though now. They're using the blood test more often.
Oh, because they found that the blood test is picking it up? Well, how often could you miss it by just the blood test?
Well, see, that I'll have to get back to you because that's a moving, urologists are the doctors who kind of specialize in prostate cancer.
The men doctors.
Yeah, doctors for men, lots of female urologists out there.
Oh.
Yes.
And yeah, that's what I meant. Doctors for men. Yes.
Doctors for men, right. And the urologists have a society where they try to determine the best way to screen for prostate cancer. And so they're trying to determine if the PSA, because the blood test picks up so many that are not prostate cancer, that they're trying to figure out, is this the best way to look for prostate cancer? They also are trying to determine whether the finger picked up enough, so there's some combination, and based on your age and your risk that they use for that. And I can come back to you with the most up-to-date information on that.
Okay. Well, let's talk about how you can prevent or catch early, I guess, colon cancer and lung cancer, since those are the two very common cancers. Can you catch those early?
Yes, you can. Right. So based on, so colon cancer, let's start with colon cancer. And we all know the colon is, part of your gut where your food comes through and then the poop comes out at the end in your rectum. So all of the tube that all that happens in is your colon. And sometimes you can get a cancer in the colon. Because it's a tube, it's hard to see on scans sometimes. So you can do a scan, like a CAT scan, where they have a picture, but the tube is white and it can't see inside. So that's why it's important to get this type of test, a colonoscopy, where they have a tube, a small, very skinny tube that they can put up into the colon. So
There's
they can
that tube up the rectum again. People don't like that, Dr. Sara. Help them figure out why it's so important.
Okay, Chadwick Boseman. Okay, I saw Black Panther last night at the Kennedy Center. Oh my gosh. Okay.
Was it good?
Oh, it's like I took my 12-year-old daughter. We're like, that's a 42 out of 10. It was so good. Anyway, and just seeing him, he's such an amazing actor, and to lose him so early to this disease was heartbreaking. And it drove home a couple of things. Number one, colon cancer in African Americans, especially men, is a little more aggressive in many cases. So it is so important for us as a people to recognize that in general, when you look at all the cases of colon cancer and you divide them into race, you find that in the African American race, tends to happen at a younger age. And it tends to be, when it's found, more aggressive. And that doesn't mean as everybody, if you're Black, you're going to have a bad colon cancer. It just means it's important for us to get in there and get screened. Is it more aggressive, or has been at a later stage when we find it in African Americans because we don't get screened? Maybe that's part of it. Maybe if everybody did their colonoscopies at the age that we're told to, we can catch them earlier and change those numbers that say that Black people tend to get colon cancers when they've already spread.
So what age should we get our colonoscopy?
We should get them. So in general, for most people, it's 50 years old to start. Now, the gastroenterology societies are saying, because we're finding that African Americans tend to get it at an earlier age, to start at 45. So the recommendation is 45 for African Americans.
Okay, so Black people, get your colonoscopy at 45, catch it early. It's preventable, it's curable if we find it early. What about lung cancer?
Okay, and very quickly, if your colonoscopy is negative, you don't have to do it again for 10 years.
Oh.
Get it done, and they don't worry about it for 10 years. And if they find a polyp, like my first one, they found 2 polyps when I was 50. They hadn't told us to start at 45 yet, but.
And just because you have a polyp does not mean you have cancer.
No, we know that not all polyps are cancers, but we know all colon cancers start as polyps. So anytime a polyp's in there, it's got to go. And they took my 2 polyps out and they sent them to the lab, and they looked under the microscope and they said, okay, these are not precancerous polyps, but because you had them, you're at a higher risk of having them again. So I had to come back in 3 years and have, instead of 10 years, like my friends who had clean colonoscopies, I came back in 3 years. Then there was 1 polyp, and they looked at it under the microscope and they said, this is really a benign polyp. You don't need to come back for 5 years. So that's, you got to know what you're doing, because you don't know you're a person who's going to be at high risk for polyps until you have that colonoscopy.
So people, listen to Dr. Sara, get your colonoscopy. I know it's unpleasant, we've had them, but it's so important. It can save your life. Think about the Black Panther. If he were alive today, I'm sure he would want all of us to get our colon cancer screening, right?
Absolutely.
All right, what about lung cancer? Can you prevent or find that early?
Yes, well, so now we have something called these low dose CAT scans for screening for lung cancer. And they wanted to make sure that whatever the screening was, the way we look at the lungs, it was something that wasn't going to use something that was going to increase our chance, like radiation. So they said,
because radiation could be a risk factor for cancer.
Absolutely. So
they tried to find a test that eliminated that as a possibility.
Right. So they said, should we do x-rays every year? Should we do a whole CAT scan? So they developed this low dose CAT scan. So it's got a low radiation dose so that when you have it, as often as they recommend, you're not increasing your risk of cancers by just having the test. So there's to be someone who needs to have this test to look for lung cancer, you have to meet these criteria, meaning they've got these kind of developed these, I want to say rules, but qualifications. And if this is you, if you've smoked what they say a 20-pack year history, meaning if you've smoked the equivalent to a pack a day for 20 years, that means if you smoked a pack a day for 20 years, or if you smoked a half a pack a day for 40 years, or if you smoked 2 packs a day for 10 years, if it multiplies up to 20, then you can qualify for someone who's at a high risk for lung cancer and needs to get that screening, and your insurance will pay
But when
for it.
should you get that? Is it after you've smoked that amount? And if you, let's say you quit 10 years ago, but before that you smoked 20.
If you're currently a smoker, you qualify for it, I think just across the board. And if you quit within, and they just put these guidelines, they just changed these guidelines like 2 months ago. If you quit, I think it's within 15 years, or another one, I'm gonna have to update you. These are a moving, and the important thing is to make sure that your primary care doctor, because that's the one who schedules your screening, right? Because screens are for people who do not have cancer. Screening is for healthy people. And so you're not going to have to go to a cancer specialist like me. I don't do screening. Unfortunately, you come to me after you have cancer. Screening is important, of course, to me, because it's important to prevent cancers, but your internist, your family practice doctor, your gynecologist are your doctors who know these rules and who should be scheduling your screening. But
I bet you would be happy if we put you out of business by finding cancer early, huh?
I love it. I love it. I've started learning. So I've started focusing more on prevention. I love research, finding better treatments so that if there is someone who has cancer, we can keep them alive and the treatments don't cause their lives to be miserable. So absolutely.
That's wonderful. So we're going to talk about prevention in just a second, but let's just make sure we've covered all the early screening. So the common ones are lung cancer, breast cancer, colon cancer, prostate cancer.
Cervical.
So we covered those. What else?
She's pap smears for women.
Cervical cancer. Yeah. Something else we don't like to talk about.
So curable if caught early, and so not curable if not caught early. So, and it happens in younger women. So it's another thing where, you might be at an age where you're not thinking about this type of thing, but get in there and get your screening done, your pap smears. As we get older, they've just, they came up with you, as you get a certain age, if you've had 3 negative ones, you don't have to do them anymore.
Yeah.
And so, this is something that I know when I was young, a long time ago, it was a big deal because it was one of the few effective screenings that we had, but it seems like it's falling off. People aren't thinking it is as important as it is. One of the other things that's great about what's happened about cervical cancer is as the HPV. So HPV
human papillomavirus.
Right, human papillomavirus. That causes venereal warts, which are warts in areas that are genitals, but it also can cause cervical cancer. And when we finally found that this virus changes the cells so that they turn into cancer cells, there is a vaccine that can be given, another vaccine, to young people. My daughter's 12, she's going to get hers, and it eradicates that virus so that as you get older, if you're exposed to it, it doesn't evolve and turn into a cancer.
So what you're saying is, because I hear a lot of pushback from parents, my daughter, is not sexually active, why should she be vaccinated? What you're saying is, if the person is vaccinated early on, even years later, when they do become sexually active, when they come in contact with it, their body is ready to fight it off because they got vaccinated. Is that what you're saying?
That's what I'm saying.
Outstanding.
Thank you.
Yeah. And if you are not sexually active, do you still need to be screened for cervical cancer? I have older women asking me this question. I haven't had sex in 20 years. Why do I need to, and they still have a cervix. So
Right.
what do you do in that case?
So that's where that whole 3 negative pap smears, you don't need to be screened anymore, and you're not sexually active. And so because, as there were, it became an acknowledgement that there were women who were not being exposed to, the virus that causes cervical cancer. Is not always the virus, but the majority of the time. And so, instead of putting them through that, because it's not a comfortable exam, they came up with the criteria that 3 negative and you don't have to come back.
Yeah, that's great. A couple more, I know they're a little obscure, but they scare people. Pancreatic cancer, so cancer of the pancreas, and ovarian cancer, because they're usually caught so late. So what's going on there, Dr. Sara? Why can't we find these cancers early?
Yeah, so you're absolutely right. Pancreatic cancer especially is one of those cancers that we don't have a screening test for, and it's very difficult to catch it early because of where it is. So cancer in and of itself, if you had a cancer and it was in your body, it doesn't hurt. Cancer is not painful, doesn't cause pain, and it doesn't do anything. It's a cell that sits there and it grows. It divides very rapidly. And when it causes problems is when it either pushes on something, or it erodes into something that bleeds, or it just blocks something, gets to a point. So that's why cancers like the breast, because the breast tissue is easy to feel if there's a lump a lot of the times, so it's easier for us to detect it and catch them earlier. And things like colon cancer, they bleed sometimes, and blood in the stool can be a sign of cancer. Now, the pancreas is in the middle of our chest and abdominal cavity. It's really not close. We can't touch it. It's not close to.
So it's like hidden between the guts and the lungs and the
liver. It's just
okay.
On the liver, and right in the middle there. And so if there's a small cancer, you're not going to feel it. And the pancreas doesn't have a lot of stuff around there. It's got
Look at this, Dr. Sara.
Oh, there we go.
I just happen to have this.
Isn't
that? So what Dr. Sara is saying is that the pancreas is tucked back behind here. And so it's hard we don't often think about it unless it starts squishing on, it's growing so big, it's squishing on stuff, right?
See that clear hole right below the stomach, right above the colon and below the stomach, that little area right in there, honestly, is where your pancreas is. And there's nothing, around it for it to bump into, or,
So it's a lot of room to grow before you actually know something's going on. Yeah. I'm so lucky we had this. Okay.
That helps.
Yeah. Well, you've been so great answering all my questions. But please tell us before we go.
Yes.
How do you prevent cancer? What should we be doing?
Well, healthy living is kind of this general term that we use for preventing heart disease and diabetes. And a lot of it is the same for cancer. So not smoking is a big one, because we know not all smokers get lung cancer or in other cancers related to the changes that smoking causes, but the majority, like 90% of lung cancers, are caused by smoking. So
what do we know about people who don't smoke and have lung cancer? Do we know anything?
We know that there are other things that can change the DNA. We don't know what they are specifically.
Yeah.
But it's just, we know that cancer anywhere in the body happens because there's damage done over time by all kinds of things. Could be in your environment, could be what you're putting in your body, could be some genetics you're born with that made something not work quite right. And it's a combination, it's not one thing. And that can come together, and that cell can start to grow in a very disorganized and rapid way, not doing what it's supposed to do, and divide. And those kind of cells become more and more and take over the areas of our cells that are supposed to be working for us.
Yeah. You just know so much about this. I'm sorry, I keep taking you on tangents. We're talking about prevention. So, okay, smoking. So try to cut down or quit smoking. What else?
Smoking. Well, the other thing we know is having a good BMI, right? The BMI is your body mass index, which is another way of looking at weight, just not being obese. And so there's two things. Not to make sure you try to keep your weight where it's supposed to be. Not you have to be super skinny. Figure out by your height and what you're supposed to be, where you're supposed to be for your BMI from your doctor or a chart, and then target that. And the other one is getting some type of exercise. And that doesn't mean you have to go out and take a class or do aerobics or run, or like just walking, just the act of getting your heart rate up a little and moving is important in reducing your chance for cancers. And we're finding that in many cancers.
But do we understand why? Like, why having extra weight or extra fat around causes or links to cancer? Like, what's going on there?
They're different things. Some of it's related to hormones, and some cancers, it's more important than others. Breast cancer, there's a part of breast cancer that is hormonally related. We know that we make estrogen and adipose or fat cells, and we know that regulation that way. Same thing with prostate cancer. So we're not always sure of the exact reason that there's a link. Sometimes that's how we find that there's a link. We look at the cancer and we look at all the people who get that cancer, and we try to find common things amongst, and then we start testing. Okay, looks like we got a lot of people who, maybe a little overweight. Okay, let's do a clinical trial where we either have people who are overweight and have them help them lose weight and follow them, or we look at people who might be overweight and then people who are not in the same group and follow them over the course of time and see, do we have a reduction in the cohort, in the group that are not overweight? So that's how we determine these things that are related to, that we believe are related to cancer. And then we start working backwards. Okay, well, why is this happening? What is it about this being overweight that may contribute to cancer? So then we have to start looking at fat cells and what they do with the body, and that cancer, and do they have any relationship to the cancer, the way it's metabolizing. And
we're gonna have to have you back to talk about just cancer research, right? You know so much about this. I want the community to really benefit from everything you know. But what about food though? Because we have food confusion. So you talked about moving your body, maintaining healthy weight, not smoking.
Right.
Food, that was a challenging one because there are so many conflicting studies out there about what you should eat. Like some people will say you should not eat any red meat, like red meat causes cancer. But then there have been other studies that have actually shown there's no association. So what are people to do when they think about food and cancer?
What you said is exactly right, though. It is confusing. Even honestly, for me, trying to keep up with, because I'm focused more on the treatments and all, and then I'm like, it became more and more. We became more and more aware of the importance of things like diet and nutrition, and in terms of cancer and its effect. So one thing I will say is that if you are diagnosed with cancer, and even if you're not, a good nutritionist is key. Is just
somebody to help you understand what to eat. Yeah.
And so check with your doctors, honestly. I was in a situation, a family member had cancer. I went to the appointment with them, and then they said, okay, you're going to talk to our nutritionist. And I sat there and I listened, and they, that's all that they do is learn about the studies and how food affects our diet, affects not only what it's doing in our body, how it interacts with other medications and things like that. But yeah, so in terms of, just in general, so fat, right? So fat and red meat, we tend to follow in terms of cancer, kind of low fat. Doesn't have to be no fat, but if you're going to have,
I prefer it's not no fat. We need fat. Like there are vitamins A, D, E, K. You need fat in your diet. So get rid of the no fat diets.
Absolutely. Honestly, things like osteoporosis, vitamin D is absorbed into our body with fat. When I was in my 30s, they found I had osteoporosis because, back then, we were all trying to lose weight. I took all fat out of my diet. I was eating rice, and then I was running, and then I got a fracture in my hip, a stress fracture. And they said,
how old are you?
32.
No.
And they were like, at first, because I was African American, and the osteoporosis is usually seen in thin white women, they were just like, oh, she got a stress fracture. Okay, well, let's fix it. And then finally, a doctor's like, why do you have a stress fracture at 30? And they said, let's look at her bones. They did a bone density, and they said, you've got osteoporosis. And it hadn't even, and so then they would, why do you have osteoporosis? And they did all these tests of my parathyroid. And then finally, I'm saying, I don't eat fat. And they're like, you have a vitamin D deficiency. You need, and I was so happy. There's like, eat cheese, eat this. And I put fat in my diet, and now I don't have osteoporosis anymore.
Yeah, and this is just a reminder to people who take vitamin D supplements. They need to take it with a meal that has some fat in it to make sure you're getting maximal absorption of it. So,
yeah.
Wow, that's fascinating, Dr. Sara. Thanks for sharing that. What about sunshine and vitamin D? There's some helpful hints there too, right, for cancer prevention.
Absolutely. So sunshine, we get vitamin D from sunshine. That's why we were thinking there's more vitamin D deficiency, because people aren't getting out as often. So it's important during the day if you can. That's another thing I made myself do, get outside, even if it's just sitting outside. Protect yourself though. Even, people with melanin, you need to have sunscreen, especially on your face.
But people have asked me, if you put on sunscreen, doesn't it block the impact of the sun on the vitamin D? It's a good, think about it. So you shouldn't put on too much sunscreen. Or what's the balance? You need a dermatologist too to answer this, I suppose.
Yeah, you're getting out of my waters here.
Don't worry, we're going to talk to one of those too, but. Okay, well, Dr. Sara, this has been amazing, and just love having you on. I love the accessible way you communicate about health to people, especially something so scary like cancer. So any last words before we go?
No, thank you. I love being on your show, Lisa. Thank you.
Well, it's our show, so we'll see you more and more, but really appreciate you and your time. So thanks a lot, Dr. Sara.
Absolutely. And if people ever don't know where to go or what to do, just call a hospital. Call cancer.
They might not answer the phone though. Let's just real talk.
That'd be real. That's right.
And they call, they're on hold, they get into the push this button and push that. So, but I get your meaning. So what do you want them to do?
Call the American Cancer Society. That's a good place. That honestly, that's a place where you will get good information. Okay,
and we'll put their information in the notes below. So that's a great tip. Okay. So thanks so much, Dr. Sara.
Thank you. Talk to you soon.